Joining me now is Nejat Altuntaş, doctor at Namık Kemal University Hospital from Tekirdağ, to talk to us about the coronavirus vaccine. Good morning, doctor. Welcome to the program.
Good morning. Thanks for having me.
Okay, now a vaccine against coronavirus could help beat lockdown and get back to normal life. Two American firms believe they're close, but where do we stand after the Moderna and Phizer breakthroughs?
Yeah, okay. With the coronavirus, we learned a new terminology. It's named infodemic. Infodemic means overabundance of the news, which can be fake, which can be truth, or as well as humors. That's why, again, I would like to thank you for giving me the opportunity to explain the fakes, especially on the vaccines and the other facts on coronavirus. As you said, there are 5 companies. They are very close to the finish. 2 of them are the virus which are inactivated. I mean, Russian company and the Chinese companies. I don't think that their vaccines are so effective. As you said, the Moderna and the other German-based company vaccines are so effective. But we have the interim data, not the finished data. But at the end of this year, we're going to get the full data on the vaccine effectiveness. We learned that Moderna vaccine is effective 95%. The other German-based company vaccine is effective 92%. So I hope that at the end of this year, we're going to have the vaccines. And also, at the end of 2021, there will be a relief, especially we're going to finish the coronavirus next year. But we still have to wear the mask because the problem with the vaccines is maybe you have a vaccine, get vaccinated, you're going to finish the disease on you, but you still shedding the virus to other people. That's why we will still have to wear the mask on our face. Mm-hmm. But that will be a very big relief at the end of the next year. I think we're going to finish this disease. So I hope that there's a big opportunity, especially with these vaccines.
Okay. All right. Now, let's have a look at the national situation. Can you explain Turkey's current situation? We're avoiding lockdowns at the moment, but what do you have to say about that? Do we need to have lockdowns?
You know, in Turkey, if you look at the numbers, our numbers are very low, especially when we compare our numbers with the other Western countries. You know, especially in Spain, in England, they have 25,000 cases every day, but we still have the 2,000 cases in Turkey. But the big difference, especially in numbers, we only explain the patients, not the cases. You know, there are 2 terminology in medicine. The cases and the patients are totally different. Cases, the people who don't have the symptoms, we call them cases. The patients who have the symptoms, just like a fever, coughing, and the pain. So we only explain at the moment, our health ministry explain the number of our patients. That's why our numbers are low. But if you compare our numbers, even our patient numbers, our numbers are very low. Because, you know, especially in England, their problem was they believed in the herd immunization. I have friends in England, doctor friends, and Spain. People still don't care about the virus. Maybe they don't believe in this disease, and they don't care, and they still gather together. They convene, they make the meetings. So in Turkey, we still care for we wear the mask. We care for our social distance. That's why I think that our numbers are lower than the other countries. But our numbers started going upside. So we should also be careful. But if you compare also our death numbers, yesterday I think we had only 9 90 people died. But if you compare with the England, 500 people died in England. I think it's just because of our health system and our doctors, because we have city hospitals at the moment. So in city hospital, we have lots of intensive care units, beds. And that's why I think that our health system is much more better than the Western countries. So what I want our people, they should wear their mask, they should care for their social distance, and they should clean their hands.
Sure, absolutely. Now, cases and fatalities have risen in the last month. This was expected as viral respiratory tract infections always rise in the autumn and winter. How soon will it be before cases and fatalities subside again for us?
Yeah, as you said in your question, because of the other viral infection, just like the influenza, our numbers are going upside. But, you know, influenza generally vanishes at the end of December. So at the beginning of the 2021, I think our numbers will start going down. And I would like to give a good news to our people. Turkey will be one of the first countries who will get the German-based vaccine, BioNTech vaccine. You know, there are two doctors, they are Turkish-rooted. They have a Turkish ancestors. That's why I think they are still like the Turkey. That's why they would like to give their vaccine to Turkey firstly. And so we will be one of the first countries to get these vaccines. So I hope in the March 2020, we will be very get a relief, especially in the term of all the viral infections and the disease.
Okay. Dr. Altuntaş, it was a pleasure speaking to you. Thank you for that information.
Yeah.
Thank you.
Thank you very much. Having me. Thank you. Bye-bye.